Hi everyone, welcome to another edition of Moments with Lulu. In today's video, we are going to be talking about courses you must take seriously in nursing school. If you're watching this video, I also need you to check with your institution and your faculty to know their policies and procedures and the curriculum as well, because this might be different for all institutions. So you want to make sure you're getting a direct first-hand information from your faculty and from your faculty's website. So without further ado, we're going to get right into this video. The courses I mentioned in this video are your foundational nursing course, your anatomy, your physiology, and your medical microbiology. These are courses you're most likely to take in your first semester of nursing school. And these are very important. So make sure you're taking these courses very seriously because they will determine how well you can function in the clinical setting. So you want to make sure that you're taking these three courses very seriously in your first semester. I know first semester is usually the challenging part of university education because most students haven't experienced what university is like. But I encourage you to use all your resources, seek your instructors, and I also made a video on strategies you can apply towards studying as a nursing student. I'm going to leave a link to that video in my description box and at the end screen of this video, so you can check it out and check out any of those learning strategies that you can adapt while studying in your first semester of nursing school. Or in your second semester, you'll be required to take courses like health assessment, pathophysiology, and your nursing theory courses. So these are also very important. These are also courses you must pass according to the set grade of your faculty. So you must meet that minimum grade to proceed on to the next semester or to take any other course in the program. So you want to make sure that you are taking these courses seriously. You want to find mini study groups. You want to find people in your cohorts. You want to meet with your faculty. You want to be in close contact with your instructors for any questions. Don't leave any questions unanswered. Make sure you're using the resources available to you, especially in first year, because it's like the most challenging year because you're new to that learning environment. It's a first time, and you should also embrace that you're a new learner. Just make sure you're using the right resources, meeting the right people, and doing the right thing, and you'll be good. Other courses are pharmacology and your more of your foundational theory classes. And trust me, if you're following the right study guide, if you're using flashcards, if you're using Quizlet, if you're seeking your instructor, if you're going to class every time, you won't be having so much struggles. Trust me on that. Yeah. Make sure you're looking at your notes for pharmacology every day. You don't want to fail this class or be in a position where you have to repeat this class, because if you are, it's going to bring you some years behind. So if you're going into your pharmacology course, make sure you're going into it with an open mind. You have to be ready to learn in order to learn. You need some kind of motivation. You need to make sure that, oh yeah, I got this. You want to give it your all. You don't want to start panicking at the early stage. Embrace that you're a new learner. Embrace it's something new to you. Make use of effective study strategies. Eliminate all distractors. Always go to your office hours. Always, always, always. Meet with your instructor, meet with your pharmacology instructor. Set office hours yourself. Don't wait for no one is even going to ask you how well you're studying or how well you're doing in the class. You need to take that position to advocate for yourself whenever you're having any struggles in this class. Pharmacology is a class you don't want to play with because this is a very important class in nursing. It's a class you need. It's a class you need, not a class where you have a choice to fail or not. You don't have any choice. Your only choice is to pass this class. So you want to make sure that you're adapting every strategy you can. If you're struggling, make sure to go to your instructor. Make sure to have mini study groups. make sure you can find helpful videos on YouTube. Like I mentioned, sarahregisterednursrn.com. She's a very, very good resource for you. Make sure you're looking for all these people. Do not leave any stones unturned. If there's something, or if there's a particular aspect of the course you do not understand, you must bring it up to your instructor or to someone else or to a fellow student. I need you all to know that having a good understanding of your foundational course is key to your clinical experience. And clinical comes thereafter. So these courses are not courses that you take and then you drop them or you forget them. No way. If you go on summer vacation before your second year, you want to make sure you're reviewing. You want to make sure you're always revising your foundational courses, because you will see the effects by the time you start your clinical experience. Trust me, no instructor or no prof is going to come to your acute care clinical or to your maternity clinical and ask you or reteach you the information you should have known from your first year courses. No instructor will ever do that. And you don't want to struggle in clinical, you don't want to put yourself at risk for failing. So you may need to make sure that you are on top of the game. You need to make sure that you are constantly reviewing materials from your first year and from your second year prior to clinical experience. Yes, we are all humans, you can always forget stuff, but at the same time, you want to keep reviewing. If you're going into clinical tomorrow and you know your patient has a heart problem or has a heart disease, for example, and they are on a drug like beta blockers, you need to know the anatomy of the heart. You need to know how the heart is structured, and you need to know the function of the heart to be able to give your patient that medication. So that is where your foundational course comes into. That is why it's something you take along with you. Don't drop it, don't forget it. Continue review, but you don't want to go to clinical and be lost or give your instructor that impression that you don't know what you're doing. So it is your responsibility to review those materials from previous years so that you're not struggling in clinical, and this way you'll be successful and your instructor will be impressed that you know what you're doing. Yeah, so that's the end of my video for today. I hope this was informative and helpful for you. If you found this video helpful, please don't forget to leave a thumbs up and don't forget to share with your loved ones. Just so I don't take you by surprise, my next video is not going to be on a nursing topic. I'll be talking about international students or migrant life. So everyone, thank you for watching today's video, and I'll see you all then. Bye now.